Hey, welcome. Before we dive in, a little background. I spent 30 years working in healthcare, in the business office, and in compliance, so I've seen firsthand how the system works and how confusing it can be for everyday people. That is exactly why I made this. Quick note, everything here is for general educational purposes, so always consult with a professional for your specific situation. Now, if health insurance has ever felt overwhelming, you're in the right place. No jargon, no confusion, just the basics. Let's get started. I want to start here because I think this is important. A lot of people skip health insurance, especially when they're young and healthy, because it feels like an unnecessary expense. But here's the reality. One emergency room visit, one accident, one unexpected diagnosis can cost tens of thousands of dollars without insurance. I'm not saying this to scare you. I'm saying it because knowing the stakes is the first step to protecting yourself. Health insurance is not a luxury, it is a foundation. Before we go any further, let's make sure we're speaking the same language. There are 6 terms that show up in almost every health insurance conversation, and once you know these, everything else starts to make sense. Premium, that's what you pay every month just to have coverage. Deductible, that's the amount you pay out of pocket before insurance starts helping with the bigger bills. Copay, that's a flat fee, like $30 for example, every time you visit a doctor. Coinsurance, after your deductible is met, you and your insurance split the remaining cost. Out-of-pocket maximum, the most you will ever pay in a single year. After that, insurance covers everything. And network, the group of doctors and hospitals your plan works with. Screenshot this slide so you have it for reference later. Okay, so now let's put it all together. Here's how it actually works in real life. First, you pay your premium every month. That keeps your coverage active, whether you use it or not. Then when you go to a doctor, you might pay a small copay at the visit. From there, you start working toward your deductible. Once you hit that deductible, insurance steps in and starts sharing the cost with you through coinsurance. And once you hit your out-of-pocket maximum for the year, insurance covers 100% of everything after that. It is a system, and now you know how to move through it. When you're picking a plan, you're going to see these 2 terms a lot, HMO and PPO. Here's the simple definition. An HMO, or Health Maintenance Organization, requires you to choose a primary care doctor who manages your care. You need a referral to see a specialist, and you have to stay in network. The trade-off is that the premiums are usually a lot lower. A PPO, or Preferred Provider Organization, gives you more freedom. No referral needed, you can see specialists directly, and you can go outside of network if needed. But that flexibility comes with a higher price tag. So the quick rule of thumb is HMO equals more structure, lower cost. PPO equals more freedom, higher cost. Think about what fits your life right now, and that will point you in the right direction. Let's talk real numbers because I know this is where it gets a little confusing. These are examples. Every plan is different, but this gives you a feel for what costs actually look like. Your monthly premium, it might be around $200. Every time you see your doctor, you might pay a $30 copay. Your deductible might be $1,500, meaning you cover the first $1,500 of medical bills before the insurance helps. And your out-of-pocket maximum might be $7,000. So no matter what happens, you will never pay more than that in 1 year. When you are comparing plans, look at all 4 of these numbers together, not just the premium. This one trips people up all the time, so let's clear it up. In-network means your insurance company has negotiated a deal with the doctor or hospital, so your costs are lower and your insurance actually covers it. Out of network means no deal exists, and you could end up paying the full price or close to it. The number one thing I want you to take from this slide is the pro tip at the bottom. Always check if a provider is in network before you book your appointment. You can call your insurance company, You can check their website. You can search your plan's directory. It only takes about 5 minutes and it can save you hundreds. So how do you actually choose a plan? Run through these 5 questions. The first one, can I afford the monthly premium? Do my current doctors accept this plan? 3, what is the deductible? And could I cover it if something came up? Does this plan cover the services I actually use, like prescriptions, mental health, or specialist visits? And finally, what is the out-of-pocket maximum, and is it manageable? If you can answer yes to all 5, you're in good shape. This checklist works whether you're picking a plan through your employer, the marketplace, or anywhere else. Having insurance is step 1. Knowing how to actually use it is step 2. Here are 4 habits that will make a real difference. First, use your preventative care. Annual checkups, screenings, and vaccines are usually covered at 0 cost. Do not skip them. Second, always have your insurance card with you and keep a photo of it on your phone. Third, when you get something called an explanation of benefits in the mail, do not panic. It is not a bill. It's just a summary of what was billed and what insurance paid. Wait for the actual bill before you do anything. And fourth, review your plan every year during open enrollment. Your life changes. Make sure your plan still fits your needs. Okay, let's wrap this up. Here's what I need you to walk away with today. Health insurance protects you from bills that could otherwise completely derail your finances. Know your 4 numbers, the premium, the deductible, copay, and out-of-pocket max. HMO means lower cost with more rules. PPO means flexibility with a higher price. Always check if a provider is in-network before your visit, and use your preventative care. It's already paid for. You now know more about health insurance than most people ever bother to learn, and that is a real win. If you want more guides like this one, breaking down the real adulting stuff nobody taught you, head on over to sunnyvibes.com. Everything is there waiting for you. Thank you so much for being here today.